Welcome back. Time now 7:23. Here's a look outside of the Good Day Charlotte studios. 55 degrees out there right now, and it's going to stay about there throughout the morning. Going to get warmer about into your low 60s later this afternoon, and possibly some showers, but overall a pretty nice day. And it's getting warmer though. You know, we're about to spring, which means we're about to summer, which means you got to pull out those shorts and swimsuits. Not everybody's ready to throw on the swimsuits in particular, so Dr. Kevin Smith joining us here from Charlotte Plastic Surgery to discuss if you are thinking of possibly going under the knife to get yourself ready, what you need to know. Thanks for coming in.
Well, thank you for having me.
So first things first here, if you're thinking about doing this, certainly you want to weigh your options, right? Talk to a few different doctors and see who might be the best fit for what you're thinking of doing. What do people need to ask the doctors when they go to the office for the initial visit?
It's very important to make sure that the physician is certified by the American Board of Plastic Surgery, and as well that they work in an accredited facility, either hospital or in their office, to make sure that they are completely set to take care of any emergency possible.
Now, how about procedures that you're thinking of having done? A lot of women, I would imagine, come in and just say, you know, I walked by the mall the other day and there's bathing suits there and I just don't like how this looks or how that looks, but they don't necessarily know the options as far as what they can do to fix that.
Yeah, and so many women have worked really hard through the winter, and then the new bathing suits come out and they try them on and they're just not quite where they want to be.
Especially if they've had kids, right?
Exactly.
There's only so much you can do.
So now's the time we talk about, you know, patients come in and ask about breast enhancement, enlargement, or lifting, or tummy tucks. For body contouring, especially those moms, the combination being the mommy makeover, the classic procedure to tighten up those muscles and to get rid of that extra skin. And then for other patients, there can be some body contouring issues where there is some, you know, extra fatty tissue, but the skin is good. And then suction-assisted lipectomy, or suction is
liposuction.
Liposuction is a very useful procedure, and there's still time to get these done before the summer.
Yeah, talk me through a couple of those, and just sort of, I know some of the more common procedures that you mentioned there. We had some before and after pictures. It seems like it would take a while to recover and have things kind of looking good enough to, you know, expose it in a bathing suit. I mean, how much time are you talking? How invasive are these procedures?
One of the beauties of plastic surgery is we do have concealed incisions, so the incisions can not be completely healed, but you can still look good in a bathing suit or a bikini. We hide those incisions appropriately. Though it takes 6 months to completely get over an operation, you're really beach ready in 2 to 3, depending on the procedure.
And I know people always ask, I'm sure, plastic surgeons, the pain. I mean, if you're talking, especially, I know that I watched John and Kate +8. Do you remember that show when she had the tummy tuck?
Yes.
And you saw her sort of step out of bed and it was like she couldn't even, I mean, is it a tough recovery process, especially if you're talking about moms who are getting surgeries? You know, moms can't take a week off and stay in bed and not be able to chase their kids around necessarily.
Right. We now have revolutionized tummy tuck surgery by 2 products. One, an injectable long-acting Novocaine or numbing medicine that lasts for 3 days. And we found that with this product, the narcotic demand is down 60%. You just don't need so many narcotics, and consequently, you get better much faster. Also, we're using a technique called progressive tension sutures with tummy tucks, where we're literally suturing the skin back down to the muscles, and we don't have to put in drains anymore. And both of those things have really reduced what used to be a 3-week recovery down to a week to 10 days. It's still a week of help at home.
You got to take it easy,
necessary.
Right. Let the husband step in a little.
But patients are moving quickly.
And as far as time in the actual operating room and then recovery and things, are any of these outpatient, or are you typically looking at least at a night or 2?
All of these operations are outpatient. Yeah, everything we do. We have 3 certified operating rooms in our office, and we do everything there. Many plastic surgeons do work in the hospital, but also as an outpatient basis.
Well, as you mentioned, certainly the most important thing is just to get all that information ahead of time, make sure you're with the right person, and then to see, you know, decide from there if that's for you. Thank you so much, Dr. Kevin Smith with Charlotte Plastic Surgery, for coming in.
Thanks.